This little mini lecture is about Borrelia burgdorferi. In the late 1970s, a mysterious outbreak of rheumatoid arthritis near the community of Lyme, Connecticut, attracted the attention of Dr. Alan Steele. He found it odd that the onset of illness had a seasonal occurrence, with most cases occurring during the summer and early fall. The disease was also peculiar in that those who lived in or visited rural locations were disproportionately affected. This suggested there was an insect vector and it was an infectious disease. Dr. Steele named the illness Lyme disease, and after that, the search began for the causative agent. It turns out the organism Borrelia burgdorferi is the cause of Lyme disease. And Lyme disease now has a wide distribution, but then areas of much heavier infection. It is the most common vector-borne disease in the United States. About 40,000 confirmed cases per year in the U.S., and the CDC estimates there's actually around 300,000 people who got infected in 2013. Endemic areas include Wisconsin. Woohoo! Here's a map from 2015 of reported cases of Lyme disease, and as you can see, Lyme disease is found heavily in the Northeast and then also in Wisconsin area. Confirmed cases are shown here, and you see that this has been steadily rising and is of serious concern. The microbe is a spirochete. It's 10 to 30 microns in length, so it's very long compared to E. coli, which is like 5 microns, and it's thin. Shown here on the right is a dark phase microscope of the organism, and you can see it has this like wavy, it's actually circular motion. It's like a little corkscrew. It's phenotypically and genotypically divergent, and it's split into subspecies. The subspecies that causes infection in the United States is actually quite a bit different than the one that causes infection in the European and Asian sector. It has an interesting genome with a linear chromosome of about 900 kb and 21 plasmids, with 9 of them being linear. Remember that most microorganisms have just a few plasmids and chromosomes, and many of them are circular. It's metabolically dependent on its host. And in fact, it's a scavenger, and it's been shown that it actually will use some of the host lipids in its own membranes. So, clinical manifestations. Ticks from the genus Oxyades spread the disease, and these are much smaller than the common wood ticks. Shown here is a very close-up picture on the right. And then as for scale, here is the head of a needle, and the larva, the nymph, and the adult stage. And as you can see, even the adult stage is very small, and you're not going to really detect this tick on you. The rate of B. burgdorferi infection of ticks varies widely, between 3 and 50% in the different surveys that have been done. Eggs are laid. In the spring, those eggs will hatch, and the larva will have a blood meal, and they prefer mice for this, but they will attack other hosts. They then differentiate into a nymph, and then over the fall they will go dormant, and they will stay dormant over the winter, and in the spring they will become active again, and they will take a second feeding on a host. Right? And this host is, again, they prefer mice, and they will differentiate into adults, and then the adults in the summer and the fall will then bite a third host. And in this case, they prefer deer, and they can also attack humans. And the active nymphs and the adults will attack humans, and then thus can spread the disease. The adults will then lay eggs, and then these will overwinter and then hatch in the spring. So it's a 2-year life cycle. Host 2 and host 3 can be humans, and they will spread the Lyme disease bacterium from host to host during this time. So, what is the course of the disease? Well, there's actually several stages. In stage 1, which occurs 7 to 14 days after transmission, you will get this characteristic bullseye rash. It's seen in about 75% of cases. Sometimes there is a fever, malaise, and flu-like symptoms. They will, at this point, disseminate through the skin, blood, and lymph tissue, and after about 3 to 4 weeks, the rash subsides. Later on, in stage 2, you'll have a systemic infection days or weeks after the initial rash. Possible symptoms include multiple rashes at various sites, infectious of the nervous system or heart, fatigue, chills, or fever. You can also have headache, muscle ache, and joint pain, swollen lymph nodes, and secondary skin lesions. You then progress into stage 3, and this is when you get more serious and unusual symptoms. And this is when the microorganism penetrates deep into tissues. It migrates to areas where the immune defense is not as prominent. In stage 1 and stage 2, the immune system responds, deals with the microorganism, but then it migrates into areas where immune defense isn't as strong, isn't as good. And that would be the joints, and you get Lyme arthritis caused by a painful inflammation. You can have infections of the cartilage and rarely bone. You can have infections in the nerves and the spinal cord, and infection of the heart. So this can be very serious without treatment. So the mechanism of pathogenesis, virulence determinants vary between strains, and there's only a couple of them. One that we know about. One is unique mobility. They have this ability to drill into tissues, and that mobility in drilling into tissues allows them to penetrate. They also seem to have adhesins on the surface, and these adhesins allow them to bind to tissue like when they're traveling through the bloodstream and then start drilling into the tissue around the blood vessel that they happen to be in. They also are capable of degrading the host cell extracellular matrices and penetrating through there. They also seem to be capable of antigenic variation, so they will change their surface proteins so that the immune system won't recognize them again. They do not make any known toxins as far as we know right now. So, diagnosis. Lyme disease is difficult to diagnose simply from the presentation of symptoms. Early stages can be confused with the flu or other viral infections. Later complaints of joint pain can be mistaken for other types of arthritis. Neurological signs can be misconstrued as multiple sclerosis. Basically must check for the presence of antibodies against Borrelia, and that is actually becoming a common practice. Clinical isolation is rarely done due to difficulty in culturing the organism, and a positive antibody test is normally an indication that you do have Lyme disease. Treatment is fortunately quite simple. Doxycycline, which is a semi-synthetic derivative of tetracycline, is very effective against this organism. Doxycycline is used because it can penetrate through all the tissues of the body and get into the areas where the Lyme parasite may be residing. Most patients respond well to treatment, and if it fails, the second round of antibiotic therapy almost always works. A vaccine against Lyme disease consisting of the OSPA protein from B. burgdorferi was developed. It really didn't succeed in the market just because at the time there wasn't that much demand, but because of the rising incidence of Lyme disease, there's a renewed interest in creating a vaccine against it. All right, finally, preventing Lyme disease. Imagine you are at the CDC. Brainstorm ways to decrease the incidence of serious cases of Lyme disease. Give you a few seconds to think about it. Please pause the video, write down some ideas, and then I'll tell you some of the other things that you could do. Okay, the easiest way to get at Lyme disease is educate people about managing their exposure to the tick in the wilderness. They should wear DEET so that will repel the tick. They should check for ticks, even though it's difficult, and make sure they haven't gotten bit by it. And then be aware of the symptoms of Lyme disease, especially the characteristic rash. And if they come down with those symptoms, to seek treatment from a physician.